Hey Sarah, what is thalassemia?
Well, according to the Mayo Clinic, thalassemia is an inherited blood disorder characterized by less hemoglobin and fewer red blood cells in your body than normal. The CDC says that it is caused when your body does not make enough of the protein hemoglobin, which causes red blood cells to not function properly and last for a shorter period. This results in less likely red blood cell circulating in the bloodstream.
I see. I wonder what the risk factors are.
Well, actually, thalassemia is passed from parents to their children through mutated hemoglobin genes. Thalassemia occurs most often in African American populations and in people of Mediterranean and Southeast Asian ancestry.
That's interesting, but I wonder what a typical visit to the clinic will be like for patients with thalassemia.
Good question.
Hi, my name is Peggy. I'm the nurse practitioner student. I'll be helping you today, okay?
Okay.
Alright. What is your name?
Tiffany.
Tiffany. Nice to meet you.
Nice to meet you.
And Tiffany, what brings you in today?
Oh, it's just recently I've been feeling really weak and tired.
Weak and tired? Okay, and when did this start?
It's been ongoing for a while now.
Okay. So I've looked over your paperwork and it looks like you have a history of thalassemia, is that right?
Yeah, that is. So
Okay.
I've been getting these symptoms usually when I'm exercising and right after I'm exercising where I'm tired, I have chest tightness, hard breathing, and then my vision goes black and I have throbbing headaches for hours afterwards. I was wondering if it's related to it.
Okay. Let me go ahead and perform your physical exam and we'll see what's going on, okay?
Thalassemia sounds really interesting. Do you think you could look it up and tell me more about it?
Yeah, let me do a quick search on the interweb. Okay, so this is what I found. There's two different types of thalassemia, and it seems to depend on which protein is affected and the severity of the anemia. So the types depend on which protein is not being produced. So when you have a low alpha, it would be considered a alpha thalassemia, and if you have a low beta protein, then you would be considered having a beta thalassemia. In terms of severity, it can range from having no symptoms of anemia to mild anemia, and these can be categorized into cases of minor, intermediate, and major thalassemia. In the case of major severity, a patient may experience severe symptoms and may require frequent blood transfusions even. Yeah.
That's interesting. What are the signs and symptoms of thalassemia? So you mentioned a little bit about the alpha and beta thalassemia. Do you mind expanding a little bit on the different types?
Yeah, let me look it up real quick. Oh, okay, so I found one that's called constant spring. This one's the most common non-deletional mutation of the alpha thalassemia types. It mostly affects Asians. There's been an increasing rate in North America of constant spring due to immigration patterns.
That's interesting.
Yeah, and then there's also Cooley's anemia, and that's the severe form of beta thalassemia. And there's a third form that I found that's called the hemoglobin Bart hydrops fetalis. And that's the most severe form of alpha thalassemia, and it's usually lethal for the fetus, so they don't even make it past birth. Oh, this sounds so complicated. I wonder how it's treated in the clinical setting.
Okay, so it looks and sounds like everything is clear. Have you been taking any iron supplements or any medications?
I've been taking iron supplements before, but I just kind of forgot to take it for the last 2 months.
The last 2 months you said? Okay, so what I'm going to do is I'm going to send you to go and get your blood work done. I want to check your CBC, which is your complete blood count, and we're going to monitor your blood iron levels every 3 months, okay? And I also want to recommend that you set an alarm on your phone so that it reminds you to take your iron supplements every day, okay?
Okay, sounds good.
All right, so we'll go ahead and move forward with that. Go ahead and get your blood results. They should send that to us within a few days, and we'll schedule you a follow-up appointment to see how your results turned out, okay?
Okay.
All right. Any other questions?
No.
All right. It's nice meeting you.
Thanks.
Okay. Have a good day.
You too.
If a patient is a carrier of alpha or beta thalassemia trait, has a mild trait, or has no symptoms, then no treatment is necessary. There is a series of 3 treatments for moderate to severe thalassemia. The first step is to perform a blood transfusion, which provides healthy red blood cells with normal hemoglobin. This has to be repeated every 120 days. For beta thalassemia major, or also known as Cooley's anemia, these patients will need transfusion every 2 to 4 weeks. The great thing about blood transfusions is that it allows the person to feel better, improves quality of life, and allows the patient to reach normal adulthood. However, blood transfusions are expensive and carries the risk of transmitting infections and viruses.
So the second step is to perform iron chelation therapy. So what happens with frequent blood transfusions is that it leads to a buildup of iron in your body, which can cause iron overload. The excessive amounts of iron in the body can cause damage to liver, heart, and other body parts. Iron chelation therapy removes the iron from the body, which prevents the damage from occurring to the organs. The 2 medicines used for this are
Deferoxamine and Deferasirox. The third and final step is folic acid and B vitamin supplements, which help the bone marrow produce healthy red blood cells. Other treatments may include blood and marrow stem cell transplant.
So what are the implications for practice as a nurse practitioner?
Well, as primary care providers, we want to monitor their blood iron level by obtaining a monthly CBC and blood iron level every 3 months. The leading cause of death among people who have thalassemia is heart disease caused by iron overload. And by monitoring their levels, we can make sure that they're not having too much or too little iron. Also, we want to encourage a healthy lifestyle with diet and exercise. And we want to monitor and manage their heart, liver, and major organ functions. We can do a yearly heart function, liver function, and viral infection like hepatitis B and C and HIV, yearly iron buildup level in liver, and yearly vision and hearing test.
Cool. And that's thalassemia!
So my name is Peggy. I'll be helping with you today.
Hey, Sarah. No, that's weird. Okay.
Okay, hold on. Restart. Okay. Hold on. What am I saying?
Sorry. This is very long.
Look at you knowing how to spell it.
I know. Dang. Okay.
Okay.
Okay. Hi.
Hi.
See. Oh. Fatigue. Weakness.
Most constant non-delicious.
Low growth.
How many more?
2 more.
Okay. And
Is
We
it
can change. Let's look up a synonym.
Yeah, let's not use that word. Nobody knows what that word is.
oh, do the Mayo Clinic at a time. Oh my gosh.
And then turn around, smile, and slap the whiteboard.
As in like.
Hella good. This is the bad quality too.
Oh my god.
Is that the new one?
Wait, I have to introduce my whole name?
Just hi, I'm Peggy,
Okay,
the
okay,
nursing
okay.
student that's gonna see you today.
Again.
Defer, Xerox.
Why is there a glare?
It's fine.
Are you sure? You can't even see fatigue.
Go.
What? I don't know.